New research around a minor stroke, or TIA, which is basically a stroke that came and went quite quickly, is changing the way and pace physicians test for patient risks of a secondary stroke. Currently, most doctors use an MRI scan to determine if a patient is at high risk. However, now there's another way.
What we did was we said, well, everybody gets a CT scan anyway. What about if we add a very simple test that takes 5 minutes onto a CT scan? So you give an injection of dye, and then you can look at all the blood vessels from the top of the heart all the way up to the top of the brain. And we said, well, you know, the reason that people have recurrent strokes is all about plumbing problems, so narrowing of blood vessels. And so if we could see them, then probably we could identify those at high risk.
MRI scanning uses magnetic fields, and CT uses small doses of radiation. The positives about this CT scan testing is that the results only take 5 to 10 minutes, and CT scanners are far more available in most major emergency facilities. The CT research followed 500 patients over a 3-month period, and the results were there.
One is that those with normal scans we can send home, and they will still be investigated and seen as an outpatient. They'll have aspirin and things like that started. The other ones, though, will admit to hospital, implement new treatments, and we have new trials running in those patients to try and reduce the risk of those patients going downhill.
79-year-old Shirley Christensen has a history of stroke in her family. One morning, she woke up with a few warning symptoms and knew there was something wrong. She did, in fact, suffer a TIA stroke. She was CT scanned and luckily was sent home.
I've had a series of procedures since, and they've all turned out just fine. And if I ever have another one, then I would phone for an ambulance and go right to the hospital.
Shirley says she's glad she took matters into her own hands and went to the doctor when she started experiencing warning signs of a stroke.
Everybody should know their own body. And if you have an eye that's not opening quite right, you know, and when you're not speaking correctly, then there's something wrong. And so there, you should take it within your hands and do something about it.
The next step for stroke research includes a new clinical trial to help treat artery blockages in the brain. Now, this is currently under review by Health Canada with hopes of being started in April. This is just another crucial step in the right direction for stroke patients on a local and international level. For Shaw TV, I'm Lisa Wolanski.